Hi, my name is Bill Facco. I'm the President and CEO of Acclarent. At Acclarent, the vision is to be the preeminent ENT company in the world, and we're working on a number of different technologies to help achieve that vision. Technologies that will be utilized in the ear, the nose, and the throat. Our primary focus to date has been with our balloon sinuplasty technology in the nose, but we are envisioning that within the next couple of years introducing a number of different products that will be used throughout ENT that we believe will serve an unmet clinical need and help reduce the overall cost of the healthcare system. Chronic sinusitis is a huge prevalence. It affects over 37 million Americans.
The sinuses are a series of interconnected hollowed spaces in the skull. Their walls are lined with mucus-secreting membranes. Small hairs sweep the mucus out of the sinuses so it can drain out through your nose. These mucous membranes may become infected or inflamed because of a cold or allergies and can swell up and block the nasal passages so that fluid from the sinuses can't drain. Buildup of fluid in the sinuses causes pressure and pain. Doctors call this sinusitis.
The treatment options that are currently available prior to our technology are really somewhat limited. So patients can go on medical therapy, of which a large portion of them will become refractory to these steroids or antibiotics over time. And their only other option is destructive surgery, where they use sharp instrumentation and shavers to take out and core out the bone and tissue to create an opening. Our solution in the introduction of balloon sinuplasty is to customize flexible instrumentation to navigate around existing structures to open up the sinuses so that they can drain and heal themselves.
Recently, a new, less invasive technology called balloon sinuplasty has been introduced. Using this technology, a balloon catheter is delivered to the blocked passageway and is gently inflated, widening the opening of the passageway and thus allowing drainage and relief from the pain and pressure.
Less destructive. Patients normally resume normal activities within 24 hours, less post-op meds, and feel significantly better. There's a significant amount of data on the technology. There are over 30 peer-reviewed publications, and they basically summarize across the board that the technology is incredibly safe, is effective, and patients feel better, a significant improvement in their quality of life.
About a year and a half since my surgery with balloon sinuplasty technology, and I have felt great. I have not had the reoccurring infections every month. I'm able to breathe, I'm able to sleep at night. I don't have that sinus pressure up near my forehead. I have felt awesome. The
second technology I would like to speak to you about today is our middle ear technology. So this is technology that's designed to treat patients that suffer from otitis media. So for those of you that are parents in the group, I'm sure that you've had your kids that have been exposed and have had many earaches and had to go on antibiotics for a period of time. Well, there's 1.2 million tubes that are placed each year. So actually over a million patients in the U.S., primarily kids, will have to undergo a myringotomy procedure where they take a knife blade, create a incision in the eardrum, and then manually place a tube that allows for the ear to drain and ventilate. The procedure works very well. The only issue with it is that patients are exposed to general anesthesia. So not only is there the concerns of general anesthesia, but the other major concern for parents is just the separation issues of watching their 1-year-old or their 2-year-old be carried down the hallway to go under general anesthesia, and it is a gut-wrenching experience for those that have gone through it. So what we've set out to do is with our Wiggle program is actually be able to numb the ear under local anesthesia and treat these patients in an office setting under local with the parent present in a 20-minute procedure.